साहब इन टर्म्स ऑफ एक्सेस, जब हम एक्सेस की बात करते हैं कि भाई जो जरूरत की चीजें हैं वो मुहैया कराई जाएं लास्ट माइल तक, तो उसमें सर्जरी के उस आयाम को इन्होंने बहुत सरल किया हुआ है। डॉक्टर साहब एक रोबोटिक सर्जन है, सर्जिकल ऑन्कोलॉजिस्ट हैं, इनका पूरा नाम जो है वो है डॉक्टर सरवना राजामनिक्कम, एंड सर जो है तंगम हॉस्पिटल नामाकल से आते हैं। डॉक्टर साहब आपके लिए बहुत बड़ा चैलेंज है, बिकॉज जो टॉपिक हम डिस्कस करने वाले हैं वो कुछ ऐसा है, अगर मैं शब्दों में उसको पिरोऊं तो ऐसा है कि बड़ी अजीब सी जिंदगी है, जो मिल नहीं सकता वही तो चाहिए। So I introduce Dr. Saravana and request him to introduce the panelist and carry on the session.
Thank you, Vivek, for the invitation. Am I audible?
Yes, Dr. Very much.
Yeah. So thank you, Vivek, for the invitation. Thank you to Dr. Vijay Patil and Dr. Kumar Pravesh for making this possible. Or I'd like to introduce our esteemed panel. We have a star-studded panel. I hope all of you are online. So the first is
Dr. Ravi Kannan could not join probably.
Yeah. Okay. No problem.
Yeah.
So I think we have able people. So I'd like to introduce as part of the panel, Shri Viji Venkatesh, madam, who's heading the Max Foundation for the regional head for Max Foundation in India, including South Asia. Dr. Bhavesh Poladia, he's my colleague and a medical oncologist, struggling with us at the last mile of cancer care in the country. And esteemed Shri Priya Dutt for joining us in this discussion. So I'd like to just start off with asking a question. Like Bhavesh and me are young. We are the young people who have just entered into this limelight. I'm like 10 years out of training from Tata Memorial Hospital, gone directly to the grassroots, and working with the public at the lowermost level available in the country. But I want to know from established veterans like Priya ji and Viji madam, how was this thing 10 years ago and how is it now? So access to cancer care. So it's definitely a continuum. It would have been better 10 years, but what is the visible change that you have seen in the last 10 years and up to now?
Viji ji, would like to start?
Yeah, I think
yes, Priya, of course. If with your permission, I would like to go back to 20 years because it was exactly 20 years ago that access program without any kind of precedent was put in place for a rare leukemia called chronic myeloid leukemia, and I joined that project. And it was something which one had never imagined, that a drug which has to be taken lifelong so that leukemic counts can be kept in place would be donated at no cost to the patient on such a large scale. So this is the drug I'm talking about, is imatinib, Gleevec. I, of course, am with the Max Foundation, and Novartis was our pharma donor partner. So they donated the drug to patients at no cost, and the Max Foundation was invited to administer the program. Today, 20 years later, I am seeing patients who were maybe 10, 12, 20, 30, 40, 60 years of age. They have lived these 20 years with that extension of life, great quality of life, no financial burden upon the patient. Have things become better? Well, there are not many pharma companies that are working on access to treatment in the same manner that this company, Novartis, worked all those years ago. But I think the idea was seeded, and I think it's the role of the non-profits, and I think the government also has to play a big role, because it is not just the responsibility of the industry. Any access program has to be built on robust partnerships between stakeholders. So yes, the idea was there. It was implemented wonderfully. It was a little difficult to sustain because it is a rare cancer, but today the Max Foundation is managing the lives of over 22,000 patients who are on this drug,
Wow.
especially just in my region, South Asia region. And other companies are coming to other non-profits, and I think the partnership between the industry and the non-profit is very, very important to build upon.
I think it has. I think you have, built that relationship over the last 20 years, and it shows in your work also. Priya ji, any comments from your side?
Yeah, I completely agree with Viji ji. And so I'm with the Nargis Dutt Foundation, who's worked with cancer care for the last 40 years. And in this duration of 40 years, I've seen amazing changes in India. Now, I mean, it's definitely positive that we have the best doctors, we have the best facilities. At that time, there was not even enough equipment to treat patients. But today we have well-equipped hospitals in place. Access is there for treatment, but access will only happen when there is a diagnosis.
Yes.
Now, people don't have enough access to even diagnose their condition. So, doctor, you would know that many times patients come to you at a very late stage.
Yeah.
So when a patient comes to you at that stage, cost of treatment will increase threefolds maybe. And I think that is the connect which somehow has to be made smooth. Whereas cancer can be detected early, treatment costs are lowered, and and there is access to very good treatment in our country, and people can live a very healthy life after that treatment. As Viji just said, she's seen people living for 20, 30 years as very normal people. And I think that is where the lacuna is, and we really need to address this issue. We and NGOs play a very key role in that. For us, we are focusing on awareness and early detection. As Dr. Patil mentioned, that the three most prominent cancers in India is breast, cervical, and oral. So, and we also know what the fears in people are. Nobody wants to come to a medical camp to get checked because the word cancer is there. So that awareness, dispelling the myths of cancer is very important. Whenever we speak about cancer with a lot of fear of, अरे किसी को cancer हो गया है अभी बेचारा ये. I think we need to kind of change that narrative and approach cancer as any other disease, which if detected early can be cured. People can have a good life after that.